We're back with new information right now showing nationally and right here in Colorado, cases of sexually transmitted infections are on the rise. Karen Wendel, the director of the HIV and STI Prevention and Control over at Denver Health, joining me now in the studio to talk more about sexual health and how to get tested and make sure you stay safe. Karen, thank you so much for being here. An important topic people probably don't talk about enough. Curious, why are the rates for STIs so high right now?
You know, we don't entirely know. This is something that we're seeing nationally and also locally. And so over the last 5 to 6 years, we continue to have chlamydia rates that are over 25,000 cases in Colorado each year. And gonorrhea rates in the last 5 to 6 years have gone up 76%. We've had a threefold increase in syphilis rates. We think things like lack of use of condoms and people not getting tested enough, treated enough. And so we really want to encourage folks to come in, get treated and tested as soon as they have any symptoms, and also just for screening.
Are there a certain age group that this is happening with? Is it younger people, older people, or everything in between? You
know, for gonorrhea and chlamydia, we see this primarily in people that are less than 25 out to 30. But syphilis and new cases of HIV have a broader range of people that are involved.
Okay.
So even older ages.
What are some of the basic symptoms of this that people should kind of be aware of? And if they have them, definitely go see a doctor or see a clinic like yours.
So it does vary a bit by the STI. For gonorrhea and chlamydia, we usually see discharge, pain, and that's usually genital, but can be at other sites like the throat or the rectum. For syphilis, we're mainly thinking about ulcers or rashes. In more serious cases of syphilis, people can lose their hearing, lose their vision. And then, unfortunately, many of these STIs are actually asymptomatic, but patients have this low-grade infection that can lead to chronic problems. And for gonorrhea and chlamydia, that can lead to infertility, problems with pregnancies, chronic pelvic pain. For syphilis, we can even see cardiac issues or neurologic problems.
That's a lot. That's more than what I think a lot of people may just think in terms of their sexual health.
Right. So we really want to get people out there to get tested.
And you talk about basically people being potentially asymptomatic or have very low-grade symptoms. I guess that goes to the point is if you are sexually active, get tested, right?
Yes.
How do people go about doing that? Easiest way?
I think the best thing to do is to talk to your provider, figure out what's the best testing interval for you. And that can depend on who you're sexually active with, your age group, other issues. And so really we recommend that people check with their primary care provider, look at urgent care and EDs if they have symptoms, but sexual health clinics, and really a lot of local health departments have low cost or free testing available. At Denver Health, to increase access and really address this increase, we set up an online testing portal where people can order their own tests. It's called Test Yourself Colorado. They can get them sent to their home, completed at home, send it in the mail, and we'll help them get treated if they're positive. All
right, really no excuse when you do it that way, right?
No.
Okay, and most of these are treatable, yes?
Yes,
okay.
Curable.
All right, Karen Wendel, thank you so much. Good information, appreciate it.